This session is about the innervation of the teeth. By innervation, we mean the arterial supply to the teeth, the nerves which will supply the teeth, and the venous drainage. So, the arterial blood supply of the teeth is by the internal maxillary artery. It is divided into mandibular, the pterygoid, and the pterygopalatine. So, the mandibular artery supplies the inferior alveolar nerve is a branch of the mandibular artery which supplies the lower molars, the premolars, the canines and the incisors. Basically, the entire lower teeth are supplied by the inferior alveolar. Whereas the infraorbital artery, which is a branch of the pterygopalatine artery, supplies the upper incisors and the canines, and the posterior superior artery supplies the upper molars and the bicuspids. The venous drainage is the nasopalatine, the infraorbital, descending palatine, the posterior superior alveolar, the pharyngeal, deep temporal, mesenteric, inferior alveolar and the middle meningeal. They drain into the pterygoid venous plexus, and that in turn drains into the internal maxillary vein via the superficial temporary vein, which in turn drains into retromandibular vein, the external jugular vein and the internal jugular vein, the superior vena cava, and then to the heart, to the right atrium. There are even microcirculations like the arterioles, the capillaries and venules. The arterioles are 50 micrometer diameter. They enter the teeth through the apical foramen of each teeth. You can see the arterioles here in between the dentin. In these pictures, you can identify them. The microcirculation also contain capillaries which are 8 to 10 micro in diameter. In the coronal portion, the capillary blood flow is twice of that which is seen in the root. In the pulp horns, it is greatest blood flow is seen. The nerve supply, the fifth nerve supplies the teeth, that is divided into ophthalmic, maxillary and mandibular. Only the maxillary and the mandibular branches supply the teeth. The posterior superior the nerve, it supplies the maxillary teeth. The infraorbital supports the maxillary premolars, and the anterior superior supplies the maxillary anteriors. The mandibular, the lingual and the inferior alveolar. Inferior alveolar is divided again into inferior dental and the incisor. The inferior dental supplies the mandibular molars and the premolars, and the incisor branch supplies the cuspids and the incisors. You can see in the picture the fiber location within the pulp. Okay. The sympathetic efferent post-ganglionic fibers are the fibers of the pulp. The location of the intradental sensory nerves can be seen. The A fibers, the myelinated fibers, and the C fibers, that is the unmyelinated fibers. You can see A fibers externally, and within the center core of the pulp, you can see the C fibers. The A fibers are the ones which give the sharp shooting pain, whereas the C fibers give the dull pain. You can see the type of fibers. The alpha fibers, the function is of motor function and proprioception. The alpha beta fibers is of pressure and touch. The A gamma fibers is of motor and to muscle spindles. The A delta fibers are pain, temperature and touch is by A delta. The B fibers are preganglionic autonomic fibers. The C dorsal root fibers are of pain, and sympathetic fibers are post ganglionic sympathetic fibers. Thank you.